Welcome to this educational video on dermal fillers, one of the most popular non-surgical cosmetic treatments available today. You know me, I love a good pop, but sometimes we need something a little less intense. That's where fillers come in. Whether you're bothered by wrinkles, sagging skin, or loss of volume, dermal fillers can offer a minimally invasive solution to help you achieve a more youthful and refreshed appearance. In this video, we'll delve into the world of dermal fillers, exploring what they are, how they work, and what you need to know before considering this treatment. So whether you're a filler newbie or just want to brush up on your knowledge, stick around. So what exactly are dermal fillers? Imagine them as little plumping pillows for your face. They're these smooth, gel-like substances that are injected beneath the skin. Think of it like adding volume back into a deflated tire. It plumps everything back up. Now, the most common type of filler is made from hyaluronic acid. Don't let the word acid scare you. This stuff is found naturally in our bodies. It's like a moisture magnet, drawing water to the skin and keeping things nice and supple. When injected, these fillers can work wonders on wrinkles, folds, and even enhance those lips for a fuller pout. Fillers can be used in so many areas, it's like a magic wand for your face. One of the most popular areas is the cheeks. As we age, we lose volume and things start to head south. Fillers can restore that youthful plumpness and give you a subtle lift. Then there are those pesky, nasolabial folds. You know those lines that run from your nose to the corners of your mouth? Fillers can soften those lines, making you look less tired and more approachable. And let's not forget about lips. Whether you want a little more volume, a defined Cupid's bow, or just some extra hydration, lip fillers can give you that perfect pout. Under-eye hollows got you down? Fillers can brighten up your whole face by filling in those dark circles and tear troughs. And for a more defined profile, fillers can even be used in the jawline and chin to enhance contours and balance facial proportions. Oh, and let's not forget about the temples. They can really hollow out as we age, but fillers can bring back that youthful fullness. Okay, so you're probably wondering, what's it actually like getting fillers? Well, the good news is the procedure is usually pretty quick. We're talking 15 to 30 minutes in most cases. First things first, the area is cleaned and prepped. And don't worry, a numbing cream is applied to minimize any discomfort. A qualified medical professional will then use a tiny needle or cannula to inject the filler into the desired areas. And you know what else is cool? Many hyaluronic acid fillers actually contain lidocaine. It's like a built-in numbing agent to keep you comfortable during the procedure. Now, for the best part, there's minimal downtime. You can usually go about your day right afterward. And get this, the results are often visible immediately. Talk about instant gratification, right? Now, I'm a big believer in being upfront and honest. While dermal fillers are generally safe when performed by a trained and experienced professional, it's important to be aware of potential complications. Just like any medical procedure, there are risks involved. Let's start with the common and mild side effects. The most common ones are usually temporary and include things like swelling, bruising, redness, and tenderness at the injection sites. These usually subside within a few days. Now, there are some moderate complications that can occur, but they're less common. Sometimes you might get little lumps or nodules, especially if the filler isn't distributed evenly or if it migrates a bit. Asymmetry is another possibility if the filler isn't injected symmetrically. In these cases, a little massage or even a dissolving agent can usually fix the problem. Now, in rare cases, more serious complications can occur. One of the most concerning is vascular occlusion. This happens when filler is accidentally injected into a blood vessel. It can block blood flow, and in extreme cases, especially around the nose and eyes, it can even lead to skin necrosis or vision problems. This is a medical emergency that requires immediate attention. Another rare complication is infection. While uncommon, anytime you're breaking the skin, there's a risk of infection. Your injector should be following strict sterile techniques to minimize this risk. So, we've covered a lot of ground today, and I know it might seem like a lot to take in. But remember, knowledge is power. When it comes to dermal fillers, or any cosmetic procedure for that matter, safety should always be your top priority. To minimize risks and ensure the best possible outcome, always choose a licensed and experienced medical professional who has a deep understanding of facial anatomy. Don't be afraid to ask questions. Talk to your provider about the type of filler they're using, its safety record, and whether it's FDA approved. It's also crucial to be upfront about your medical history allergies, and any medications you're taking. This will help your provider determine if dermal fillers are right for you. And finally, remember that communication is key. If you experience any unusual side effects or have concerns after the procedure, don't hesitate to contact your provider immediately. So there you have it, the ins and outs of dermal fillers. It's amazing what a little plumping action can do, right? But remember, just like with those stubborn blackheads and juicy pops I handle, it's best to leave this to the professionals. Finding an experienced injector is key to getting those natural-looking, confidence-boosting results you're after. Always do your research, choose wisely, and remember, a little tweak here and there can go a long way. Until next time, stay beautiful.